Good afternoon. This is Dr. McDaniel. Thank you for joining me on GYN Corner. I was able to slip in a little bit early today during our lunch break. I'm usually super busy during the lunch breaks. I don't really take time to do the presentation, but today I was able to. As the notice prefaced, today I will speak a bit on fertility screening. And fertility screening is what I call a curiosity screen, because the person is not infertile, they haven't been trying to get pregnant and just can't get pregnant. And it's usually for women who are thinking about either getting pregnant straight away, they want to see if there are potentially any barriers that they might have to overcome, or they are thinking about postponing pregnancies, so they want to see if maybe they should look into doing something, getting pregnant, or doing something straight away to try to preserve their fertility, or if they can afford to maybe put it off by a year or more. Fertility screening is simply can consist of a blood test, or you can add to it by doing an ultrasound, a sonogram, or you can do what would pretty much be an infertility evaluation by adding a special x-ray called an HSG or a hysterosalpingogram. So for the fertility screening, it's essentially to evaluate that woman to see if she has any potential hormonal indication that would preclude a quick pregnancy or a normal pregnancy, or that would imply there's going to be a delay in getting pregnancy, or that she might not be able to get pregnant at all or have severe difficulty with getting pregnant. Now, in general, normal fertility is considered someone who's not using contraception, and then whether they want to or they don't want to get pregnant, 60% of couples will get pregnant if they're not using contraception within the first month of no contraception, potentially the second month, and at the outside the third month of not using contraception. That's normal fertility. And in general, most women should have normal fertility if they're under 40 years old. 40 years old is what we consider the tipping point for fertility, and that's because based on the research, 50% of women who are 40 will have normal fertility, but 50% of women who are 40 will have infertility because their eggs, their ovaries are too old. So we call that age-related infertility. That being said, if someone is under 35 years old, we give them up to 12 months to get pregnant naturally, and that's because, yes, 60% or so will get pregnant the first, second, or the third month, but the peter out for up to 90% will get pregnant within 12 months of not using contraception, whether or not they wanted to get pregnant. So by that definition, 10% of couples will not get pregnant if the female partner is under 35, will not get pregnant within 12 months. So, and the definition of infertility is someone who is under 35 years old and not gotten pregnant within 12 months. So 10% of couples will fit that category. Now, 35 years and over is considered advanced maternal age. So if someone is 35 years or older, we give them 6 months to get pregnant. So if they don't get pregnant within 6 months, then that's considered subfertile, borderline infertile, and then still the 12 months is definitely infertile. So the fertility screen is the same blood work that we would do for someone who's infertile. And that's a hormone panel consisting of pituitary, brain hormone, that's prolactin level, thyroid hormone, it's called TFTs or thyroid function test, and usually it's just the TSH, which is a thyroid stimulating hormone. And then the ovarian hormones, part of that is really from the brain, the other part's from the ovaries, that's LH, FSH, and estradiol. So luteinizing hormone, follicle stimulating hormone, and estrogen levels. In addition to that standard hormone panel is an additional hormone called an anti-Müllerian hormone, which is called an AMH. Sorry, allergies still. Now, the hormone panel is really to assess to see if this lady has normal functioning hormones that would allow her to have a regular, normal ovulatory pattern. So basically to see if it looks like she's producing eggs every month. The hormone panel can potentially be normal even if someone's not producing eggs every month, even if they have an irregular ovulation pattern, it's still going to be normal for the majority of women. The anti-Müllerian hormone is a hormone that we call it a fertility, an ovarian reserve hormone. It's part of the fertility screen. That ovarian reserve hormone is basically a way to assess if this lady's ovaries look like someone who's under 40 years old, around 40 years old, or over 40 years old. If that AMH or anti-Müllerian hormone is normal, then that tells us that she should have normal fertility for her age. And if there are other factors that play into potentially causing infertility, that she would respond to hormonal therapy to induce ovulation, or for IVF, in vitro fertilization test tube babies, that she would respond to that normally. That's why we call it ovarian reserve. That blood work is what we call a fertility screen. It's also the same blood work that's done for infertility evaluation. Now, some women will add an ultrasound or a sonogram to that fertility screen, and the ultrasound is to see if there's something physical that could impede, prevent, or inhibit implantation or latching on of a fertilized egg, and then the person's not going to know they're pregnant, or they're going to miscarry very quickly before they actually have figured out that they're pregnant. Some women will request, or some physicians will recommend, what we call a follicle count, or an antral follicle count. Most of the radiology facilities don't do that. Most of the gynecologists in their office won't do it. That's often going to be done, if it's done at all, by an infertility specialist or a reproductive endocrinologist to see basically how many eggs or follicles look like they're getting recruited naturally by that person's own hormonal system in order for the competition for ovulation, to see if it looks like she has one or two, which would be a measly amount, 1 or 2 eggs that are being recruited in order before she ovulates, or if she has 10, 12 eggs that are being recruited before she ovulates, which would be a lot. The last one would be an X-ray or an HSG. That's usually not done for fertility screen. It's an X-ray with contrast or fluid to brighten or opacify the uterine fallopian tube structures to look for scarring or blockage. So I hope that's been helpful. This has been Dr. McDaniel on GYN Corner, and that's the basic fertility screen. Thank you for watching. Have a good rest of the day. See you tomorrow.